Alani Adebayo checked the saline lock for the third time in 10 minutes, her hands moving with a fluid, practiced economy. The only sounds in room 207 were the rhythmic pulse of the monitors and the shallow breaths of Mr. Henderson, who was recovering from a ruptured appendix. Nurse Adebayo, Dr. Thorne's sharp voice sliced through the calm. Patient in Trauma Bay 1, construction site fall. Alani gave a quick nod, made a final adjustment, and moved toward the emergency department. The moment she entered the main corridor, however, she sensed it was no ordinary accident. The presence of men in crisp Air Force dress uniforms, their faces grim and their movements urgent, spoke of something far more serious, something tied to national security. She pushed open the doors to the trauma bay, and her breath caught. Master Sergeant Elias Vance was on the gurney, his fatigue soaked in blood that seeped from hastily applied field dressings. His face was ashen, but his eyes were sharp and assessing the room. Special forces. She knew the gear, the posture, the way he scanned for threats even while bleeding out. More than that, she knew him. "Alani," he breathed, his features softening with relief. "Thank God you're here, Doc." Dr. Thorne glanced up from his initial assessment, a flicker of annoyance in his eyes. "Nurse Adebayo, I need a full surgical prep. This man has multiple shrapnel wounds, likely severe internal hemorrhaging." "Doc," Vance's voice was faint but firm, "I need Dr. Adebayo on this." Thorne paused, a look of confusion crossing his face. "I'm sorry, Sergeant. There's no Dr. Adebayo on staff. This is Nurse Adebayo, and I can assure you I am more than qualified." "Get Dr. Alani Adebayo," Vance insisted, his gaze locked on her. "She's the only one who can do this." A chill ran down Alani's spine. The past she had so carefully entombed was about to be unearthed. Dr. Thorne straightened up, his confusion hardening into condescension. "Master Sergeant, you've experienced significant blood loss. You're disoriented. This is an excellent nurse, but she is not a surgeon. I am Dr. Thorne, Chief of Trauma, and I will be operating." Vance's hand shot out, grabbing Thorne's arm with a grip that belied his condition. "You don't get it. I need Dr. Alani Adebayo. She's done this before." "There is no Dr. Adebayo," Thorne repeated, pulling his arm away in frustration. "Sir, you're becoming delirious. Nurse, please administer a sedative so we can get him to the OR." "I don't need a sedative," Vance rasped, his eyes pleading with Alani. "I need the surgeon who dug pieces of a car bomb out of my chest in Mali. I need the doctor who kept my entire unit alive during a firefight. I need Dr. Alani Adebayo." The focus of the entire room shifted to her. The other nurses, the residents, even Dr. Thorne were staring. "Master Sergeant," she said softly, "you need an operation right now. Dr. Thorne is one of the best." "No," Vance's voice, though weak, carried the weight of command. "Alani, I know why you left. I know what happened in Gao, but I need you to be who you are, not who you're pretending to be." Thorne looked from the wounded soldier to his nurse, his professional arrogance battling a rising tide of confusion. What is he talking about? Alani felt the foundation of her carefully constructed life begin to crack. She had worked so hard to become invisible, to be just another nurse, to bury Dr. Alani Adebayo and the trauma of that final mission. But Elias Vance was dying. She could see it in his dropping blood pressure, in the subtle signs a civilian doctor might overlook, but that she recognized from 100 battlefield triage decisions. "Dr. Thorne," she said, her voice steady, "the Master Sergeant's injuries are more complex than they look." "And how would you know that?" he scoffed. "You're a nurse." Alani met Vance's gaze, saw the unwavering trust there. "Because," she said quietly, "those aren't random shrapnel wounds. That's a fragmentation pattern from a Sahel region VBIED. If I'm correct, he has fragments lodged near his pericardium that will kill him if they migrate during a standard surgical approach." Thorne stared at her, speechless. "She's right," Vance managed to say. Car bomb in Gao 3 weeks back. Fragments were too risky to remove in the field. His eyes found Alani's again. That's why I need the best combat surgeon the Air Force ever had. A profound silence fell over the trauma bay. Thorne looked at Alani as if for the first time. Combat surgeon? Alani squeezed her eyes shut. 3 years of hiding, gone in an instant, because a man whose life she'd saved refused to let her disappear. When she opened them, Vance was crashing. "He's flatlining!" a resident yelled. Alani moved on pure instinct, her training surging past the walls she'd built around it. "Start compressions," she commanded, then immediately corrected herself. "Dr. Thorne, we need to—" "Just do it," Thorne snapped, recognizing a level of expertise that transcended rank. Alani's hands moved with a brutal efficiency that made the other staff take a step back. This wasn't CPR learned in a classroom. This was the desperate, practiced work of someone who had done this under fire. 2 milligrams of epi, she stated, again forgetting her role. "I mean, Dr. Thorne, should we consider it?" Thorne just watched her hands, her flawless technique. "How do you know that positioning?" The monitor shrieked back to life. Vance had a rhythm. "Because I've done this before," Alani said softly. "Too many times." Thorne studied her face, his arrogance finally gone. "Nurse Adebayo, I have to ask you directly. What is your real medical background?" Before she could formulate an answer, Vance's eyes fluttered open. He grabbed her wrist. "Doc," he whispered, the name echoing from a life she'd left behind. "The fragments, they shifted. I can feel it." Alani glanced at the monitors, seeing the subtle arrhythmia that confirmed her deepest fear. The metal was moving toward his heart. They had minutes, maybe less. "Dr. Thorne," she said with urgency, "he needs the OR now." "I'm prepping OR 3. No." Alani's voice held an authority that stopped everyone cold. "The fragments are unstable. Standard positioning on the table will kill him. He has to be maintained at this exact angle with precise supports, or the metal will puncture his heart." "How could you possibly know that?" Thorne demanded. "Because I have seen this exact injury pattern 19 times in Mali, in Niger, in places you've only read about," Alani stated, her voice devoid of emotion. She looked at Vance, who was fading again. "Dr. Thorne, I am asking you to trust me. Let me assist. Let me position him. Let me help you save his life." "You're a nurse." "She's Dr. Alani Adebayo," Vance gasped out. "Air Force pararescue surgeon. 41 confirmed saves in active combat zones. The best damn trauma doc the military ever produced." His eyes met Thorne's. "And she is the only person in this hospital who can save me." Thorne stared at Alani, searching her face for the truth. 3 years of penance, 3 years of guilt. But Elias was dying, and she was still Dr. Adebayo, whether she liked it or not. "Yes," she said quietly, "it's true." The OR prep room was thick with tension as Alani scrubbed in next to Dr. Thorne. The ritual was as natural as breathing, a muscle memory that 3 years of nursing hadn't erased. "Dr. Adebayo," Thorne began carefully, "I need to know what I'm walking into. You've been a nurse here for nearly 2 years. Your file says nursing school, nothing more." "A deep cover identity check would show nursing credentials," Alani replied, her eyes on her hands. "The rest is classified." "Classified by whom?" "The United States Air Force, the Department of Defense, people with clearances you don't want to deal with." She finished scrubbing and turned to him. "Dr. Thorne, I respect your position, but Master Sergeant Vance has minutes. We can debate my resume after he's stable." Thorne considered her. "The positioning you described, the specific angle, it's a fragment pattern from an improvised device common in the Sahel," Alani explained clinically. "The metal shards are designed for maximum internal trauma. Standard surgical posture creates pressure that drives them into vital organs. I've performed this extraction 41 times. I lost 2 men, both because we couldn't maintain positioning in the field." "In the field?" Forward operating bases, operating in tents while mortars land outside and you have no backup. She met his gaze. Dr. Thorne, I'm not trying to take your OR. I'm trying to save a man's life with knowledge I wish I never had. Thorne was silent for a long moment. What do you need? Full control, she said without hesitation. This isn't collaborative. It's a precision extraction. 1 tremor, 1 millimeter of error, and he's gone. I know that's not how it works here, but this is combat medicine, and I need you to trust me. Through the OR window, they saw Vance's vitals dip again. If I let you lead, Thorne said slowly, and he dies on that table, our careers are finished. If you don't let me lead, Alani countered, he dies anyway. This is his only chance. Thorne looked from the dying soldier to Alani's steady gaze. What's your success rate on this procedure? 95% under combat conditions. And if you're wrong about the fragments? Alani's expression didn't change. Then I'm wrong. A good man dies, and I carry that with me for the rest of my life, right next to the 2 I couldn't save. Thorne saw it in her eyes then, the immense weight of command, of lives held in her hands. Dr. Adebayo, he said formally, the OR is yours. I will assist. Alani nodded once. Thank you. They walked into the operating room where Elias Vance lay, his life ticking away with each beat of his damaged heart. Scalpel, Alani said, her voice perfectly calm. For the first time in 3 years, Dr. Alani Adebayo was home. The moment the blade touched skin, the world narrowed. The OR, the observing staff, Dr. Thorne's apprehension, her own suffocating guilt, it all vanished. There was only the surgeon, the patient, and the mission. Retractor, Alani commanded. Small deaver. Her hands moved with a dexterity that stunned the surgical team. This wasn't a surgeon shaking off rust. This was a master at her craft. My God, a resident whispered. That incision is flawless. Suction, Alani continued, clearing the field. There, see it? Thorne leaned in. 3 pieces of jagged metal, one perilously close to the heart wall. Look at the alignment, Alani said, her voice shifting into that of a teacher. The blast drove them in sequentially. If we remove them out of order, the pressure changes. The others will shift, and he'll bleed out. Thorne stared into the open cavity. I've never seen anything like this. Pray you never do again, Alani said grimly. Her instruments moved toward the smallest fragment. This one first. It's acting as a fulcrum. She worked with a focused intensity, her movements tiny but decisive. The metal piece came free with no disturbance to the surrounding tissue. Incredible, Thorne breathed. Alani moved to the second piece. This one is against the pleural lining. One slip and his lung collapses. The room was silent as she delicately worked the larger, irregularly shaped shard free. Got it. She dropped it into the tray. Now for the last one. The largest piece of shrapnel sat against Vance's heart, moving with every beat. One mistake would be fatal. Dr. Adebayo, Thorne said quietly, are you certain? Alani glanced at the monitors. Vance was holding on, but barely. I've done this exact extraction 31 times. I lost one because we didn't have adequate light, and another because an incoming attack forced us to rush. She met Thorne's eyes. In a sterile OR, with this equipment and no one shooting at us, this will work. She repositioned her tools, finding the precise angle of approach. Her hands were impossibly steady. The fragment slid free. Instantly, Vance's vitals surged. His heart rhythm normalized. Unbelievable, Thorne said, his voice filled with awe. Alani began to close, her sutures perfect. You've never seen combat medicine, Dr. Thorne. When you have 30 seconds to save a soldier's life, you learn to be efficient. Is that why you left? Alani's hands paused for a fraction of a second. I left because sometimes you do everything right and people still die. and the weight of the ones you save doesn't always balance the ones you lose. She finished the last stitch. Surgery complete. Patient will make a full recovery. She stepped away from the table, and the persona of Dr. Adebayo seemed to recede, leaving Nurse Adebayo in its place, a woman who had just performed a miracle she wasn't supposed to be capable of. "That was extraordinary," Thorne said. "Your skill—" "It was a unique situation," Alani cut him off. "Master Sergeant Vance needed specific help, that's all." "But your talent is being wasted," Thorne pressed. Alani began cleaning her instruments. "I'm a nurse now, Dr. Thorne. This was an exception." Thorne watched her, a new understanding dawning. "You're not coming back to surgery, are you?" Alani met his gaze, and in her eyes he saw a pain that ran deeper than any surgical wound. "Some doors, doctor, are closed for a reason." She walked out of the OR, leaving Thorne to grapple with what he had just witnessed. But as Alani headed for the nurse's station, she didn't know that Elias Vance was already waking up, already asking for her, and already planning to prove that some doors were meant to be broken down. 30 minutes later, Dr. Thorne found Alani charting medications. His expression was a mixture of respect and resolve. "Nurse Adebayo," he began, then stopped. "Dr. Adebayo, we have to talk." "There's nothing to talk about," she said, not looking up. "The surgery was a success." "A success?" Thorne stepped closer. "Alani, what I saw in there wasn't just surgery. It was artistry. The kind of skill that takes a lifetime to acquire." "It took 4 years of combat deployments and 41 emergency extractions," Alani replied, finally meeting his eyes, "and it cost me everything." "Then help me understand. Why are you here, as a nurse, when you're one of the finest surgeons I have ever seen?" She was quiet for a long moment. "Because surgery is about making life or death calls, and I made the wrong one." "The wrong one?" "Gao, Mali, 3 years ago. A marketplace bombing. Mass casualties. I had to triage. Who to save first, who could wait, who was beyond saving." Her voice broke. 2 civilians died on my table. 2 people who might have lived if I'd made different choices." "Alani, that's the reality of a mass casualty event," Thorne said gently. "You saved lives. I lost them too, and I decided I was done playing God. As a nurse, I help, I care. But I don't decide who lives and who dies. But you just did, with Vance." "That was different." "How?" Alani's hands went still. "Because he asked for me. Because I was the only one who could—" She trailed off. "Because you're still Dr. Alani Adebayo," Thorne finished for her, "whether you want to be or not." Before she could answer, her phone vibrated. A text from an unknown number. "Dr. Adebayo, this is Elias Vance. Thank you for saving my life again. We need to talk. There's something you have to know about Gao. Something that changes everything." "Ivia." Alani stared at the screen. Gao. The day that broke her. "What is it?" Thorne asked. "My past," she whispered. "It's not done with me." The phone buzzed again. "The people you think you failed? You didn't fail them. You were betrayed. Meet me in the meditation room in 1 hour. It's time you learned the truth." Alani's hands began to shake. Betrayed? What truth? Thorne read the message over her shoulder. "Alani, you have to go." "I can't," she whispered. "I can't go back to that day." "Maybe you won't have to," he said softly. "Maybe you'll finally be free of it." 1 hour. The meditation room. The truth about Gao. Alani looked at Thorne, who nodded with certainty. "I'll cover your patients." "Go," he said simply. "Find out who you are." The hospital's meditation room was still, the only occupant Master Sergeant Vance, sitting in a chair near the window. He looked stronger, but his expression was grim. "Alani," he said as she entered, "thank you for coming." "What truth, Elias? What are you talking about?" she asked, her voice strained. "Those people died because I made the wrong call." No, Vance said, turning to face her fully. They died because you were sabotaged by your own command. The floor seemed to drop out from under her. What? The Gao mission was compromised. Intelligence knew that marketplace was a target. They knew when, and they sent your unit in anyway, under-resourced. That's impossible. Why? Because you were becoming a problem, Vance said, his voice laced with bitterness. A black female surgeon outperforming everyone, racking up more commendations than senior officers with twice your time in service. Certain people decided you needed to be taken down a peg. You're telling me my own command set me up to fail? I'm telling you they put you in an unwinnable situation, knowing you would blame yourself. They wanted to shatter your confidence. Vance handed her a manila folder marked with classification stamps. It took me 3 years to get the clearance to show you this. Alani opened it. She saw mission reports she'd never been privy to, intelligence briefs warning of the attack that never reached her field hospital. My God, she breathed. They knew. You had 30 minutes and supplies for 20 people to save nearly 60, Vance said firmly. You performed miracles that day, Alani. You saved 57 people with resources that shouldn't have saved 10. Those 2 who died, they were gone before they even got to you. But you worked on them anyway because that's who you are. Tears she hadn't shed in 3 years streamed down her face. But You could have done nothing more, Vance insisted, taking her hands. You're not just a good surgeon, Alani. You're a legend. And they broke you because they were terrified of how powerful you were. The file contained more proof, commendations that were buried, promotion recommendations that vanished. Why now, Elias? Because I need you to know that what you did for me today, that's who you are, not the broken doctor who tortures herself over impossible choices. You are Dr. Alani Adebayo, and you save lives no one else can. Alani looked at the evidence of 3 years of guilt built on a foundation of lies and bigotry. I don't know if I can go back, she said quietly. I'm not asking you to go back, he said, standing to leave. I'm asking you to stop punishing yourself for a crime you didn't commit. But I will say this, the world needs surgeons like you, and letting your gift stay hidden because a few cowards were threatened by your brilliance? That's not justice, Alani. That's just one more tragedy. He left her alone with the truth and a choice she never thought she'd have to make. Nurse Adebayo was safe. Dr. Adebayo was extraordinary and a threat to the established order. Which one would she be? 2 hours later, Alani walked into Dr. Thorne's office, the classified folder in her hand. I saw the message, he said, looking up from his desk. The truth about Gao. How are you? I don't know yet, she admitted, sinking into a chair. 3 years of guilt was a lie. 3 years of hiding because I thought I was a failure. And now I know I wasn't just good enough, I was too good. She opened the folder. Did you know that black surgeons in combat zones have statistically better outcomes under pressure? More innovative solutions, fewer complications? I didn't know that. Neither did I. But some people knew, and they decided a black woman's excellence was a problem they needed to solve. A hard edge entered her voice. They wanted to break me, and for 3 years they succeeded. Thorne leaned forward. But you're not broken now. No, Alani said slowly. I'm angry. For the first time in 3 years, I'm not guilty. I'm furious. Good, Thorne said. Anger is a catalyst. Alani stood and walked to the window. Dr. Thorne, I want to propose something. This hospital, can it support a specialized trauma program? Advanced combat casualty care for military and high-risk civilians? Thorne leaned back, a slow smile spreading across his face. Are you talking about coming back to surgery? I'm talking about doing what I was born to do, she said, turning to face him. The techniques I used on Vance are just the beginning. I can bring a level of trauma expertise here that could save lives this hospital loses every single day. You want to build a military trauma center here? I want to stop hiding, she declared. And I want to make damn sure that what happened to me, the sabotage, the cover-up, never happens to another doctor. The board would need convincing. We'd need funding, equipment. I have contacts. Alani cut in, her voice gaining strength. DoD grants, Air Force medical liaisons. I can bring this hospital expertise that money can't buy and experience that med schools can't teach. And you would lead this program? Alani thought of Elias Vance, of the 57 lives she saved in Gao, of the 2 people she had mourned for 3 years. I would be who I was always meant to be. Dr. Alani Adebayo, combat trauma surgeon. No more hiding, no more apologizing for being the best at what I do. Thorne's smile widened. He stood and extended his hand. Dr. Adebayo, how quickly can you write that proposal? Give me 48 hours. Done. Welcome back, doctor. This hospital is about to get a lot more effective. Alani shook his hand, the familiar weight of responsibility settling on her shoulders, not as a burden, but as a mantle. Dr. Alani Adebayo was back, and she had work to do. 3 weeks later, Alani stood in her new office watching as the first patient for the Advanced Combat Trauma Center was wheeled toward OR-1, an Army Ranger with IED injuries from a mission in Somalia, a fragmentation pattern she knew all too well. Dr. Thorne would assist, but she would lead. Dr. Adebayo. Her new liaison, a sharp Air Force captain named Eva Rostova, stood in the doorway. Patients prepped. The team is waiting. Thank you, Eva. Alani straightened her new white coat, the embroidery clear and sharp. Dr. Alani Adebayo, Director, Combat Trauma Center. Doctor, Eva hesitated. Word is getting out. Military surgeons, medics, people who felt broken by the system. They're all asking about this program. They want to work for someone who understands. Alani nodded. Good. This is about more than just saving patients. It's about saving the healers, too. Is that what happened to you? The system broke you? Alani paused. The system tried. It turns out I'm tougher than they thought. As she headed for the OR, Elias Vance, walking steadily now, fell into step beside her. Dr. Adebayo, how does it feel? Like I'm right where I belong, she said. Any regrets about giving up nursing? Nursing taught me empathy, she reflected. It reminded me that healing is about more than technique. I'll be a better surgeon because I was a nurse. And the anger about Gao? The people who tried to destroy me, Alani said with a grim smile, created something they never intended. A surgeon who isn't just skilled, but who is angry enough to fight the whole system. They reached the OR doors. Vance stopped her. Alani, when I said they didn't know who you were, I wasn't just talking about Thorne. I know, she said softly. I didn't know who I was either. She looked through the window at her patient, her team, the life she was about to save. But I do now. She pushed into the OR, where another impossible surgery awaited someone who specialized in the impossible. Scalpel, Dr. Alani Adebayo said, her voice steady, confident, and finally home. 6 months later, her program had saved 52 lives. The ACTC was being hailed as a revolutionary model, and Alani was consulting on national military medical policy. She was reviewing files when Dr. Thorne knocked. Alani, you have a visitor. Official Air Force business. A 2-star general in a crisp blue uniform entered her office. Dr. Adebayo, General Wallace, Air Force Medical Corps. I'm here about Gao. Alani felt a familiar chill, but this time it wasn't fear. Sir, the officers responsible for compromising your mission have been court-martialed, the general stated. Their careers are over. The Air Force owes you a profound apology and an offer. What kind of offer? A return to active duty, full-rank reinstatement, command of a new global combat medical initiative, carte blanche. He handed her a portfolio. It was everything she had lost, handed back to her on a silver platter. And if I say no? "Then you continue the vital work you're doing here," the general said, "with the full, unlimited support of the United States Air Force." Alani thought of her team, her patients, the sanctuary she had built. "General, I appreciate the offer, but my fight is here now." The general smiled. "I was hoping you'd say that. We need allies like you on the outside, Doctor." After he left, Alani went on her rounds. In room 207, her newest patient, a young Army medic named Specialist Diaz, was recovering. She'd been told she was too emotional for the OR after losing a soldier in the field. "How are you feeling, Specialist?" Alani asked. "Guilty," Diaz whispered. "Dr. Adebayo, will I ever operate again without seeing his face?" Alani sat on the edge of her bed. "Yes. Not because you'll forget him, but because you will honor him. You will let his memory make you a better, more compassionate surgeon. The ones we lose are our greatest teachers." "Is that what you did?" "For 3 years, I let my loss bury me," Alani admitted. "Don't make my mistake. Honor that soldier by becoming the surgeon who saves the next one." Diaz nodded, a flicker of hope in her eyes. Alani left the room and headed for OR 3. Another impossible case waited, the same injuries that had almost killed Elias Vance. But this time, she wasn't a ghost hiding in scrubs. She was exactly where she was meant to be. Dr. Alani Adebayo, the woman who had turned the greatest trauma of her life into her greatest strength. And she was just getting started.